Both surgery and radiation for breast cancer can cause pain across the chest, but certain exercises can also help decrease this pain and improve shoulder motion, as the tightness from inflammation and radiation fibrosis tends to be some of the main reasons for this pain. My name is Kelly. I am a physical therapist that specializes in oncology and lymphedema. And in this video, I'm going to share with you 3 simple exercises to improve pain after breast cancer surgery or radiation. Before we begin, make sure that you subscribe down below for weekly new videos. You can join us on Instagram for more related content, and you can check out my website for more resources. So I'm going to go through and show a few simple movements, but if you'd like to learn these techniques and go more in depth, then you'll definitely want to check out my breast cancer rehab program. I've been treating these issues and working with patients during and after cancer treatment for over a decade now, and I wanted to share my physical therapy secrets and knowledge with everyone. So I have a full program that guides you through all aspects of recovery, from lowering the risk of getting breast cancer-related lymphedema, to getting someone's shoulder range of motion back, to reducing pain after treatment. And I specifically have a section that I go in depth on how to improve arm range of motion and tightness and reduce the pain, as well as rehab after radiation therapy. I share these exercises and hands-on techniques in detail in the same way that I teach my patients in the clinic. So you can get access to the entire program, or you can choose the topics within recovery that you personally need help with. So for more information, just head over to my website, which I'll link in the description box down below, as well as up above. But otherwise, let's get started. So once cleared by your doctor after surgery, then we want to start with light stretches that focus on the pec muscles or the chest muscles, which are the large muscles across the chest. And these get irritated and inflamed by the surgery, but also radiation. So stretches should be light and felt mildly, but not intense and not straining. The main area of the pain and tightness is that pec across the chest. So I see about 90-95% of those that I work with have issues with this area, and then limitations with this muscle being too tight, the tendons being thickened and irritated. So it's important that we have stretches to calm down and relax these muscles and these tendons. One way to do that is with the following 2 stretches. So first is with a chest stretch with bent elbows. So for a chest stretch laying on our back, start by laying down. I like to have my feet bent up underneath me for comfort with our backs, but it's not necessary. But from there, what we're going to do is put our hands behind our head or our neck with our elbows pointing up towards the ceiling. We're going to then start to let our elbows fall out gently to the sides until we feel a mild stretch across the chest. We want to make sure that we keep it mild, moderate at most, nothing that's going to be too straining. From there, we're going to take a nice big deep breath, feeling our rib cage expand right into that tight area of our chest. And as we let our breath go, we're going to let ourselves relax further into the stretch. Make sure we keep it mild to moderate. Hold for 5, 10, up to 15 seconds. And gently we'll come out of that stretch. If someone's brand new, we can even just hold for 3 seconds or so, but 5 or 10 is best. And then repeat again. So let our elbows fall to the side till you feel a mild stretch that you can tolerate. Big breath in. And as we let our breath go, sink into the stretch. Hold there. And then when we're done, we'll repeat that 3 to 5 times. And that can be done a couple times throughout the day, just making sure that we keep everything nice and gentle, nice and relaxed, and tolerable. This stretch is a great place to start to ease into improving the motion of the chest muscles, the pec muscles, and around that area. One of my favorite stretches for both tightness and radiation fibrosis is the sideline pec stretch. So we're going to start with the sideline pec stretch. So lying on our side, we want to lie on the side that we did not have surgery and that didn't have radiation, or that's just not tight. So we're actually going to be stretching the top arm or the top side. So you can use a pillow for comfort, arm is wherever is comfortable underneath. The top arm, we're going to put our hand behind our head or our neck with our elbow pointing forward. And we're going to have our knees stacked below us. And when we're ready, we're going to open up, thinking about pointing the elbow towards the wall behind us. only until we feel a mild stretch across the chest. Now this might come quickly for some, especially with a lot of pain, or soon after. So it might only be here, it might be further, that can vary, but only till you feel a mild stretch. From there, we're going to take a nice big deep breath, really feeling yourself expand, or ribcage expand right where that tightness is. And then when you let your breath go, let yourself fall further into the stretch. Making sure that we keep it mild to moderate at most. Hold for another 3, 5, up to 10 seconds. And then gently come out of that stretch fully. And we'll do it one more time to show. So we're going to start at the front and then rotate. You can rotate your body with it. Open till you feel a mild stretch across the chest. Big deep breath in. As you let your breath go, let yourself relax into that stretch. Hold for another 3, 5, or up to 10 seconds. And then when you're ready, you'll gently come out of that, making sure you just keep everything nice and gentle and tolerable. And that can be done 3 to 5 times, and that can be done a couple times throughout the day. And then lastly, for about 30 to 40% of the individuals I work with, we see tightness, or I see tightness and pain on the side of the body where that lat muscle is, or latissimus dorsi muscle is. These muscles are often affected by surgery, and it can really limit someone from raising his or her arm above the head for bathing or getting something out of a cupboard. So the stretch that I like is the ballerina stretch. So for the stretch on the side, or that lat muscle, what we're going to do is take our arm up overhead, take the opposite hand, grab that wrist, and we're going to gently pull up and over towards the side. So I'm stretching out this side over here, allowing this to stretch out to feel a mild, moderate stretch. We can also take that same deep breath we've used in the others. Feel your rib cage expand right into that area. And as you let your breath go, let yourself sink further into the stretch. Holding for 3 to 5 seconds, gently coming out, and I like to alternate and switch to their side. So grabbing the opposite wrist, up and over, take a nice big deep breath. Let yourself sink into that stretch. And then we repeat back and forth. I know some people would only be tight on one side, but I think it's nice to be able to compare one side to the other so you know how tight you are that you're working. And a lot of us generally are tight with postural issues anyways, so it's just a nice way to make sure that we're getting good stretching overall. Someone can do this 3 to 5 times on each side, 2 or 3 times on each side, whatever feels good, and this can be done a couple times throughout the day. And those are my favorite beginner exercises for improving pain and tightness after breast cancer surgery or radiation. For progressions and dozens of other stretching and strength exercises, along with manual or massage-like techniques to help reduce this tightness and pain, be sure to check out the link in the description box down below for the Breast Cancer Rehab program. Or you can head on over to my website at cancerrehabpt.com. I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.